So here we are in Ottawa, the capital of Canada, talking about the Canadian healthcare system. It probably is fairly similar to what we're talking about in terms of Obamacare in the future, and that is that there are people that are going to tell you it's wonderful because everything is free, and there are other people that are going to tell you that it stinks because the waiting lines are long and the doctors are poor, and you end up being forced to use private healthcare if you really want something done. That's why more Canadians have their hips replaced in Cleveland than anywhere else.
Okay, here we are in the Dominican Republic, and we see a lot of small medical arts buildings, if you will. This one's called Unidad de Atención Primary, basically primary attention unit. And what you see is what you get. You're not going to get the same level of healthcare services you get in the U.S. And quite frankly, I've seen a lot of one-legged men in this country, which you'll see a lot of motorcycle riders without helmets, passengers on the back, very common. And so the care you're going to end up with may be, so amputation may be considered medical care in a situation like that.
I was reading the Sydney Herald the other day, and big controversy here because they want to start charging co-pays to all the people at the public hospitals. Why? Budget problems. They can't afford to make ends meet. The other thing they're looking to do is to reduce the number of low impact surgeries, operations, the low return, that was the word they used, low return operations. In other words, they're implementing what in 2008 Sarah Palin called the death panels, and she was criticized largely in the US for that by the media, but of course they didn't like her. It's just fine. There's not a political statement. It just happens that economically speaking, anybody who's followed socialized medicine knows that's what happens. You have to reduce costs by eliminating the possibility of surgeries, which is why the private hospitals exist, because that way, if you have the money, you can actually get it. And how did you get the money in the first place? You have presumably added value to society, and that's how if you legally got the money, a private hospital will legally allow you to take care of that. And of course, the other problem with public medicine is how do you guarantee everybody fair and equal treatment? Now I realize it's completely raining right now here in Queensland, but in the Outback, hundreds of miles from anywhere, hundreds of kilometers from anywhere, how do we guarantee services there? That's my next question. I gotta go, straighten it out. People come from miles around to see Uluru, the red center of the Australian desert, the Outback. But here's what they got for healthcare. One tiny little building. That's it. So that's the only healthcare services available in these parts. When I say these parts, I'm in the northern territories of Australia. Hold on, I've seriously got to take a drink. So what we have here is to the north about a 6-hour ride to Alice Springs. To the west you'll find a road so desolate that in order to go on that road, and it's a dirt road, in order to go on that road for 1,500 miles, you have to sign in with the police and let them know you're going there, because and then when you get to Western Australia, you got to let them know that you arrived. That's how desolate this is here. But Australians have some form of socialized medicine, some form of universal health care. Sounds great, but let's think about that. What does that really mean? Are they getting their fair share of services out here? Now, remind me again about that story about your leg, all that big gash on there. What was that? I got you on video here, so you can tell the true story now.
The true story, not the one about the camels attacking me.
Oh, that was the one. That's the one.
Or the dingoes. No, that was me and my incredible talent at being clumsy.
No, I wanted the dingo story.
The dingo story?
Yeah.
Okay, well, let me see. How fast can I do this one? 2 puppies came. No, I can't do that.
All right, never mind.
Yeah, no, I'm hanging off the back of the feed trailer, and I decide that my strength is immense, which it actually isn't. And as the hay came towards me, I went like to kick it over the side, and that didn't quite work out for me, and I slipped.
And if that gash was any worse, where would you get medical attention beyond that little general store that you got there in town?
They would fly me to Alice Springs, which is 5 hours away. So,
yeah.
We were thinking about it as well. Like, Mark wasn't sure if it needed stitches or not, but we'll just see how it goes over the next couple of days. I mean, it hurts, but it'll get better there. I've got my tetanus, so I should be alright.
You should be alright, okay.
I used to be a nurse, and my favourite part of it was wound care, so I'm happy.
Yeah.
Granted, they chose to live out here, but if you have a problem in these parts, how are you going to get medical attention? It's about maybe a 45-minute airplane ride to Alice Springs, and there's not a whole lot there. That's a 3,000 or 4,000 person community. This community here has about 12 to 1,500 workers that work here servicing the tourist industry to see Ayers Rock. Let's see, how do you pronounce that in the native tongue? Uluru. And if they want to get to Uluru, medical services, very limited. So that's not a bad thing. I'm just pointing out that if you're in Sydney, you've got access to some great health care. But if you're here, you're still paying your Australian taxes, but your access to health care is much more limited. It's kind of like when you're in the remote areas of Argentina, as an example.
Okay, just looking at the Coca selections of the herbal remedies for cholesterol, diabetes, rheumatism, there's a lot more, all these herbal remedies, and of course the FDA has not checked out any of these, so who knows what you're getting when getting this here. This one or the next one?
This one.
Okay, let's... Okay, you stick around here, Grandma. You stick around here. Rebecca, is this the coca leaf that you had?
Yeah.
And how much, what did you do? Did you eat it, or did you just...
I chewed it.
And then you spit it out?
Yeah.
So, you're a drug user, huh?
So what you looking at?
Can you see me? This is, mate is like a tea, a yerba mate in Argentina. But this is mate coca, which comes from the coca plant. So, which of course is the same plant that gives us cocaine, I suppose. I'm not an expert on illegal drugs, nonetheless. It's legal to sell here in Salta.
But not necessarily to bring home.
But not bring home.
I'm high up in the Andes Mountains in western Argentina. And I just want to actually talk about healthcare. You see, we see a little hospital sign here, Red Cross. And in Argentina, they have a lot of free healthcare. And when the family that we're staying with told us a little bit about healthcare, there's private hospitals that you pay, or there's public hospitals where you can go for free. However, you might go there and they may tell you to come back in a week, and when you come back, they may forget that they scheduled an appointment for you. Or, as an example, one of the people we were talking to was very impressed when he was in the United States. He had a problem with his knee, and he got his x-rays the very same day that they took him. But in Argentina, at the free hospitals, oftentimes more than a week. Excuse me, this was just great. A traffic jam. We are, you can't imagine the roads we took to get here. But when we were talking to someone who had spent time in the United States, he was impressed that he got his x-rays in one day, the same day that he took them. In Argentina, at the free hospitals, you'll have your x-rays taken, and perhaps a week later you'll be able to get them. Unless you pay money, then you can get them on that very day. So when we talk about free healthcare, what does that really mean? Because in this remote village, they may have free access to healthcare, but it's limited in terms of the availability of what we have in the U.S. So what do you get for free?